want to do now, I want to go to my section that I do every week on the show, 2 Year with Dr. G, called Myths versus Facts. And it's something that I really am so proud that we do this every week. You know, those of you that follow us on social media, I always put something out there after my wife does a little bit of editing and everything, but I always put something out there and I go, iHeart Myth versus Facts. But again, it's true, I do heart myths versus facts because again, it's a time to make sure you're getting the right information from the right resource and not getting your information from Dr. Google, who did not go to medical school or anything like that. It's true. But I want to make sure people have the right information so they can make the best decisions for their family and their loved ones. And so again, use me, use my source of credentialed experts to hopefully help guide you during this journey. So here we go, myths versus facts. What I do is I say a statement and then like my esteemed colleagues will either say myth or fact. I'm not trying to necessarily trick anybody, but they'll say myth or fact and then gives a few words why it's either a myth or a fact. So here we go, Dr. Undevia, first one for you. Here's a statement, myth or fact. Pancreatic cancer is always deadly.
Myth.
Please explain.
Pancreatic cancer is a very tough cancer, and many people die from it, but not everyone. Each of us has a lot of pancreatic cancer survivors.
Correct. Thank you very much. Here we go. Dr. Dahdaleh, here we go. Myth or fact. Statement. There is currently no screening test used to detect pancreatic cancer.
I suppose that would be, if I'm going to be a purist, the answer would be this is a myth because, again, as Dr. Undevia highlighted, in specific high-risk groups, there are MRIs and upper endoscopies as well as endoscopic ultrasounds that we can use to try to detect cancer early. But that being said, I don't want to send the wrong message to your listeners. For the average risk individual who has no family history and no other modifiable factors, there are no tests. There is, again, I'm going to use Dr. Undevia's, there is no mammogram equivalent for pancreatic cancer. And so we rely on the telltale signs, which are the abdominal pain, the jaundice, anorexia, or losing weight with no good reason, or new onset diabetes. So.
All right, thank you. Here we go. Next statement, Dr. Undevia. Surgery for pancreatic, I'm asking you like a surgical question because you are totally the surgical oncologist. You're the medical oncologist, but here you go. You get a surgical question. Here you go. I'm going in order. Surgery for pancreatic cancer can cause it to spread to other parts of the body. Myth or fact?
That's a myth.
Please explain. And Dr. Dahdaleh, if you want to jump in on that one, you can too.
Yeah, I would agree with that. It's absolutely a myth.
That's right. Surgery is, you cannot, almost 100% of the time, you cannot cure pancreatic cancer without surgery. Surgery is actually the curative treatment.
Thank you very much. Here we go. Myth or fact? Here we go, Dr. Dahdaleh. Next one here. People only get pancreatic cancer if there's a family history of the disease.
I would say that that's a myth.
Please explain.
Unfortunately, as we highlighted before, about 90% of pancreatic cancer cases are what we call sporadic, meaning that we do not find an identifiable familial or otherwise other risk. And so the majority is no.
Thank you very much. Here we go, Dr. Undevia. Here we go. Statement. Clinical trials are for patients at any stage in their diagnosis.
I'll say that that's a fact. At any given moment, there may or may not be a clinical trial that's appropriate for you in your area, but clinical trials are available for every cancer and at some point for every stage.
All right, thank you very much. Thanks for clarifying that. Here we go. A couple more of these. Here we go. Myth or fact, Dr. Dahdaleh. Here we go. Eating sugar will make my cancer worse.
So that is a myth.
Please explain.
That is a myth. I'll explain it this way. There's no scientific evidence to back up that statement. We don't have any, I'm not aware of any study or shred of evidence that would back up that statement. And so that doesn't mean, don't live a healthy diet.
Yeah,
eat a healthy diet, but don't eliminate sugar entirely.
I agree. I always said this comes down to, we should be having a foundation of health and wellness, and that's certainly eating a healthy diet. And we've talked about that a lot on the show. Check out some old episodes. Here we go. A couple more of these myth versus facts. Here we go. Dr. Undevia, here we go. Pancreatic cancer only affects older people.
Well, we'll say that that's a myth. It is true that pancreatic cancer under the age of 45 is uncommon and certainly does not affect children. 2/3 of people with pancreatic cancer are diagnosed after the age of 65, but pancreatic cancer can occur in any adult.
Yeah, thank you very much. And again, the average lifetime risk of pancreatic cancer, I got this from www.cancer.org, the American Cancer Society, is 1 in 64 people. All right, here we go. Dr. Dahdaleh, here we go. I'm going to give you this question. I shouldn't say a question, the statement. Myth or fact? Here we go. Pancreatic cysts, and I know we didn't talk about this much, but I'm going to say it anyways. Pancreatic cysts should be evaluated and tested for malignancy.
I would say that that is not a myth. That is a fact. I think it's a broad term, and I don't want to alarm people because pancreatic cysts. I'm going to take a minute of your time.
Yeah, please go ahead.
But pancreatic cysts are becoming more and more common because we are doing more cross-sectional imaging. We're looking for them more, for lack of a better word. And the majority of them are benign, but it is important to recognize that some of those cysts may have characteristics that we can identify with MRIs or EUS or biopsy that would push us towards labeling a risk of that being malignant. In other words, if one has a pancreatic cyst, don't be alarmed, but also get it checked out by somebody who treats pancreatic cysts on a regular basis.
Wonderful. Thank you for clarifying that. All right, guys, there you have it. Myth versus facts, pancreatic cancer. So we got about 5 minutes left, guys.